Hello everyone. So I wanted to give a 1 week update on my PICL upper cervical injection surgery. I'm a week out. I don't have any pain. I am not on any painkillers, thank God. I have pretty good range of motion at this point. Having a little bit of difficulty turning my head to the left and to the right. This is probably as far as I can turn my head to the left comfortably, and probably as far as I can turn my head to the right comfortably. Um, in terms of upwards and downward flexion, if I'm just trying to flex on sort of my C1, C2 area, I don't have a lot of range of motion. It's not necessarily painful. It's just like the area is filled with stem cells or they're inflamed or whatever. So it feels kind of tight up there. And honestly, it feels kind of good because when there's tightness, it also adds a little bit of stability. I have not been putting pressure or tension on my neck. I have not been testing my neck. This is something that I've done in the past that I have woefully regretted. Overall, I do not have any symptoms, but I have also been taking it very easy. I usually walk to work. I'm not walking to work. I'm not doing jumping jacks. I'm not exercising. I'm not biking. I'm basically not doing any physical activity for the next 2 months. I'm also taking a lot of vitamin C, taking the Regenexx stem cell formula, and then taking collagen powder as well twice a day. So I'm trying to do everything I possibly can to make sure that I'm letting my ligaments heal and giving them the very best shot at it. This was my 4th injection, and I don't want to have to do it again. Not that I wouldn't, but I want to be able to do all of the things, go skiing and bike and just not have to worry about my neck. Because right now, anytime that I'm doing an activity that's not swimming, I have to be very cautious and protective in how I carry myself. So far, I think we are on a really good path, or I'm on a good path in terms of recovery, because I don't know how to explain it, but every time I've had an injection, I always feel the inflammation and like the healing in a different part of the base of my skull or a part of the vertebrae. And this one, it feels like the ligaments that were injected are, it just feels a little different. So I know Dr. Schultz mentioned that they were changing the ligaments that they were injecting, or they were adding new ligaments. I don't know if it has anything to do with that, but it feels totally different from the last 3 injections that I had. Maybe it's because I was fasting and I had a higher stem cell count. I have no idea. So I'm hopeful. I don't know if things are going to change too much over the next few weeks. So I don't know if I'll give an update in a week or 2 or 3, but I will be back with more updates soon.